All right, I think we're recording, so. Hey friends, thanks for joining us this evening. My name is Michael. I'm one of the co-pastors here at Central, and I'm joined by my fellow co-pastor, Cleve Tinsley, and Dr. Michael Goodman Raimer from UTMB, Raimer-Goodman, right? I got that backwards.
Yeah, that's all right. Yeah.
Is the hyphenation, can you flip those any way you want, or is there a?
I mean, so like the hyphenation is really more of a social ecclesial thing, and professionally it's just Goodman. Yeah. So, but you know, I answered by whatever.
Awesome. We'll make up names today. It'll be great.
Yeah, that sounds good. That's what
yeah. So I'm joined by Dr. Michael Goodman of UTMB, and the three of us are here to kind of have a conversation about COVID-19, kind of what's happening now and how that's impacting our local community and specifically the church, and how is Christians, followers of this Jesus, do we think about our response and how we move during this time? So y'all, thanks for being here tonight. And Michael, why don't you, since they know Cleve and I, just take a moment, just kind of introduce yourself, tell us a little bit about you, what you do for UTMB, what kind of has been your role in Galveston during this pandemic.
Sure, yeah. First, Michael, Cleve, great to be on with you. Thanks for hosting this event and keeping your community informed. Yeah, so I'm a professor or assistant professor of epidemiology at UTMB. So most of what I do is actually in Kenya, like the research and work and intervention space that I'm interested in is issues of inequality and issues affecting families and children and communities, and how you can build community resilience in Kenya. And if given the chance, I'll go forever on that. So I came to UTMB to do research, to have a hub to do research in Kenya, and recently got an NIH grant that supports work there for work on issues related to HIV and HIV.
Congratulations, man. That's awesome.
Yeah, thank you. Thanks. So that's what I get to do. So I get a lot of freedom there, which is great. And then at UTMB, I'm in the division for infectious disease. So all the people that I have day-to-days with are either clinicians or lab researchers. Obviously a lot of folks working on COVID, and my mentor, friend, and boss, I guess I still answer to him. Philip Kaiser is the Galveston County Local Health Authority. So when COVID hit, obviously there's a lot of response, a lot of kind of really just things going crazy, things going up in the air. And Kaiser called me. Well, really, like in January, we knew it was coming. We knew the storm was coming, because when you see that it has a high infectivity rate and a high case fatality rate, and that it has asymptomatic spread, so that it can spread through people who aren't exhibiting symptoms. When that all became clear around like the 3rd, 4th week of January, we were all thinking, oh, this is the next big thing since 1918 Spanish flu. So we're all flying into high alert, and Kaiser was spending most of his time at the health district. And he called me, I guess in February, no, it must have been March. And he said, hey, can you come help us develop our response and strengthen capacities from the health district? And I've had a long experience of working with students, medical, public health, nursing, PT, OT students at UTMB, developing different community projects, different ways of kind of shaping student engagement, student service activities. So Kaiser said, could you come and help build teams of students to volunteer and to help build the capacity of the county? So we came in, and there's a lot of things that kind of lay dormant until you really need them, and then you have to really build them up as quickly as possible. So we did a range of things, like strengthening the liaison between the health district and long-term care facilities, making sure that everyone knew about evolving CDC guidelines for keeping people in long-term care facilities safe, trying to coordinate some response for people who are unstably housed, contacting faith groups, coordinating mass testing, dissemination of results from mass testing, and then doing follow-ups. So, you know, the runtime that a health district has to really build up its infrastructure when it gets slammed by something like COVID is very short, and the significance of it is very big. So if you don't end up getting contact tracing and testing and messaging right, that's people's lives on the line. So we came in, and we've had over 200 students volunteer for different projects, and offer over 7,000 hours for just different projects volunteering with the health district. So I did that until kind of mid-July, when sort of things normalized a bit, and I could step back and then focus on much more in my NIH grant research, kind of ongoing research from community processes in Kenya.
That's fantastic. Yeah, thanks for sharing all that. One of the reasons, Michael, I wanted you to come on specifically for this conversation was also your sort of educational journey is unique, right? So
Yes.
You have your Doctor of Public Health, which is how you're serving at UTMB, but you also received your Master's of Divinity. You went to seminary at Candler, which is a Methodist school. Shout out, though the Baptists gotcha, right? So I got two Baptists on this call right now, so I'm feeling a little outnumbered, but
We're friendly.
yeah, so I think that intersection, and what I'm hopeful for our conversation today is we can kind of bring those strands together. I think we've all heard a billion of these kind of COVID talks, but really thinking about, the church and how that intersects will be really great. So you mentioned things normalizing in July. You've talked a little bit about pandemic fatigue that I think we're all feeling right now. But from what I can tell, at least watching the news and reading, we're still kind of in the thick of it. Things seem to be ramping up a little bit. And so I wonder if you could just give us like a really brief, where are we situated right now? What are trends? What's happening? What sticks out to you? In late November.
Yeah, so if you go on the Galveston County Health District's website and you look at their COVID data, there's kind of one data point that concerns me the most within Galveston County, and it reflects trends that are going on nationally, that's going on across Texas. El Paso, they had to order 8 refrigerator trucks to handle the expected burden of bodies that are COVID related. Within Galveston County, the thing that's really concerning me is the positivity rate is ticking up. And you can look at 3 different, this being the third, 3 different kind of peaks in positivity. So the first was around March, April, it went up, and then it went back down with the shutdown, and then it went back up in like towards the end of June and July. And that was really crazy. That's a lot of patients with COVID. And then July 1st, the governor issued the mask order. So everyone had to wear a mask, closed down bars, restrictions for restaurants, that sort of thing. So you can look and see, as predicted, 2 weeks after that policy intervention, the burden of cases declines, the positivity rate declines. And so now we're moving into the third peak in positivity. And so the positivity rate had been for a bit 2% or even less, and now it looks like it's ticking back up again in Galveston County, which is consistent with some of what's happening in Harris County, statewide, nationwide, and some of, Texas was the first state to 1 million COVID cases. So way to go, Texas. Not to make too light of the situation, but anyway, yeah. So cases are on the rise, and positivity is on the rise, and what that means is the risk of exponential spread. We know that it's not really a linear trend. It's not like one person is going to infect like 1.5 people. It's much the way that COVID spreads, that we've seen it spread more, is not through like one person spreading to one person or 2 people, but one person maybe staying home and being responsible, and then another person going to some event and not being responsible. And so you have super spread events. And so the risk of spread is really based on events that people have that, for very understandable reasons, people want to get back to normal. They're tired of stressing about COVID. They want some normalcy. So they go and they do that. They have an event, and then you see an explosion again. So whenever the number of cases in the community goes up, you wouldn't really expect a linear trend. You'd expect something that becomes more exponential from that. And that's got me worried, honestly.
Yeah.
But it's a job to be worried. So
Yeah. I'm glad we have folks like you in that spot. So, so thinking about these kind of like spreader events and people gathering, like our Cleveland Mind's bread and butter, right, is getting people together. That's kind of what we do, is in-person worship. And my community hasn't been in person since March, right? We've never come back. And certainly with this kind of new spike happening, there's some concern there. So I think a two-part question. One would be, thinking about the responsibility of the church in this. The church, I think, as one of these gatherings of people, right, there seems like there's risk there if this is the way that this is spreading, like you're suggesting. And then also thinking about some of these kind of everyday spreader events and the way that disproportionately is affecting some of our more marginalized communities. So our poor communities, our BIPOC communities, not the typical kind of large gatherings that we think of, but just sort of everyday living because of high clustering of people. That's kind of like 30 questions in one, but I'm just going to let you and Cleve kind of run with any of that you want to, and see where we go next.
All right. If you don't mind, let me reframe it up a little bit. Can you first talk to us a bit, Michael,
Please.
about what you would characterize as a super spreader event, right? Say like a big gathering on the front lawn of the White House versus, say, persons who work, say, for instance, at a grocery store, right? So when you talk about super spreader events, what do you think are those areas that are most kind of harmful or dangerous for folk? Is it, like Michael said, the ordinary living where you have to go into places that have high occupancy, or are you talking about events like these big gatherings or, say, restaurants? Talk to us more about what you consider a super spreader and has the most potential.
Yeah, so the characteristics, we've kind of known this from early on, and it just takes us a little while to wrap our collective brain around it. From early on, we know that the biggest risk of spread comes from droplet. It's a droplet-borne disease, but also, and this has been a question, but it seems to be answered. It's also aerosolized, and that relates to, if it's just droplet, your droplet will fall within 6 feet typically, depending on the air patterns and whatever. But 6 feet is a good standard for that. So one characteristic of super spreader events is that you have people who are packed more closely than 6 feet together, but also you have an event where people are not doing anything to prevent the droplet spread from their mouths. So if they're unmasked and within 6 feet, that's a problem. And then, like a big problem with bars are, if you go to a place and you have drinks that are out in the open and you're all drinking together, you're not masked. And not only that, but you're spitting in someone's drink, like not on purpose, but you're just like stuff is just coming out of your mouth and it's going wherever. So super spreader events are characterized by, less than 6 feet, not masked, and then often some higher propensity to spread saliva from mouth to mouth. I mean, not just kissing, but like drinking or handshaking when you cough in your mouth or cough in your hand and shake someone's hand and it gets spread and you don't wash your hands like that. So that's the bulk of the transmission happens through droplets, but we know from other case studies and from investigating the virus itself that it's also aerosolized. So if you're in a place where, and there's certain characteristics of breathing that make the virus much more likely to aerosolize. So if you're loud, as opposed to being soft, if you're singing as opposed to speaking, then the projected volume, like the volume of air and the thrust of air that comes from your mouth is higher. And when that happens, if you're infected, it's more likely that you aerosolize the virus. So places where people sing, where they're yelling, where there's lots of people and you have to speak loudly, all of those types of characteristics of an event make it more likely to be a super spreader event. And, so if you're going to, Cleve, you asked about like going to a grocery store, just someplace that's normal out and about for you. If you're masked and other people are masked, and usually there's like high ceilings, so things that are aerosolized, particularly if the airflow is upward, and I don't know grocery stores what that is, but if there's a chance that you can prevent the droplet and then something that's aerosolized is taken away out of the air circulation, then the risk of transmitting is really low. And we've seen, like early on, there are lab-based studies that looked at the virus and saw that the virus could be viable for some number of hours or some number of days on what we call fomites, which is like not a person or not an animal, more of a thing like paper or a watermelon or whatever. And while the virus is live in a lab that way and it looks viable, the number of cases, and this has a bit of a caveat, but the number of spreading events that we've seen that have been borne by fomite-borne transmission is really limited. It's almost negligible. So the risk of something being spread through something that you would touch is pretty limited. And part of that, I think, is because there's what we call a dose response. So the more exposure to the virus you have, the more serious your illness, the longer you're ill, the less time your body has to fight off the virus before the virus really does damage to you. And maybe fomites don't carry enough viral particulate to really matter that much. Though I think that's an unanswered question. So yeah, so super spreader events, I would say just where those conditions are present and someone comes in, there's a high risk of that being a super spread event. And that's where when I don't know if CDC has an actual definition for how many people have to be infected by one person, but you see super spreader events where like 5 or more people are infected by one person. And then if those people are part of kind of social networks that aren't careful or cautious, and Michael, this is getting to your question about like church leadership. If you're part of a social network where people are disregarding really like good evidence, good science, good common sense, and are just doing whatever they want, if you infect 5 people who are just doing whatever they want, and they are likely to go to another super spreader event where they just do whatever they want, then you can see it's not, the number of people is not multiplying by 1 or 2, it's multiplying by 5 or plus in these networks of kind of cluster high spread events. But Michael, you asked does that answer your question, Cleta? Do you want to?
No, I think that's fine. That's great. You answered my question.
Yes, Michael, your question I thought was interesting about like the role of the church in all this. And I think, you know, early on, it's really a time to demonstrate what your theology is, what your kind of church body's theology is. And so you see people who early on have theologies that say, God is going to protect me from whatever I don't like or whatever I don't believe in, or this is bogus or whatever, that have a theology that's really kind of removed from the lived experience of people. And you see a number of people who were preaching early on about, you know, we're not going to shut down. This is an anathema to God, or, you know, God wants all of God's people to be in service on Sunday or whatever. And unfortunately, you see a lot of these people get sick and sometimes die. And for them, I think how they understand church leadership is in embodying that theology. And those of us who don't share that theology would ask, is that really wise? Does God want to call us to a different world? Of course, God wants to call us to a different world. Like, you know, every Christian believer believes in transformation of some sort. But what does that transformation have to do with the real lived experience of people now versus some other reality that's removed from the day-to-day experience that we share? And I would think the way that certain theologies lead to different outcomes, like super spreading events at churches that are very careless and come together and sing and sometimes yell and all that, where super spread events happen there, I would think it would give some pause, like, is this this is fruit of some theology. Is this the theology that you think God wants for you, that is removed from the lived experience of people, versus taking into consideration sort of the claims of science and understanding the way that church and theology and science relate in a more compatibilist way, that it's not God against science. It might be God through science, God alongside science, so that you don't have to throw your belief in God out to believe in science, but you can take science as a way of structuring our observations of the world, of patternizing our observations of the world that can be meaningful and useful within a larger theological framework. And so if that's your theology, then what you really have to negotiate is some of the tensions between tradition and present reality, that sometimes the things that have served you through tradition in the past are not the things that still serve you in this present reality. And you know that this present reality is changing. So the question is, can you persevere long enough doing something different? Can you take this as an opportunity to find God in your midst in a new way that perhaps you didn't before because you were relying on the traditions of the past? And, you know, hopefully, like the things that have fed us and allowed us to grow together as a community are the things that we kind of dust off and build back. And, you know, everything's going to be a bit different, but maybe similar enough in the way that it feeds us as a community and as spirited people in the future, that this moment is a transformation for God to reveal something new to us about a new way of being collectively, you know, when all is sort of quote back to normal.
Yeah, I think that's really beautiful. And I think thinking through those, yeah, you know, the phrase new normal has popped up a lot. And I think, yeah, we're not going back to whatever was. And I think especially for our community right now, you know, Cleve and I helped write a grant a couple months ago. And in it, we were talking about how this pandemic, less like created disparities that we're seeing, but more, especially for like our more privileged communities, unveiled or kind of unmasked some of those things. These inequities have been there all along, but I think we've been able to see them with like fresh and new eyes. And especially in a community like Central, where, you know, on a given Sunday, you know, 40% of my community is unhoused. More than 50% are probably lacking access to reliable healthcare, housing, food security, all these pieces. And so we've known that's been there, but it's really been a season of eye-opening for a lot of that, which has led us to ask that then theological question, you know, what should our response be during this time, and how should the church be positioning in the pandemic? I was mentioning to you guys earlier, there's a sociologist of religion, Rodney Stark. He's at Baylor now, and he wrote a book that was really interesting, kind of tracking Christianity's like exponential growth in the first 3 centuries. And he ties it to like Christians' responses during 2 plagues that happened in the midst of the Roman Empire, and how the Christian response was fundamentally different from that of sort of the rest of the world, right? And it was, people took note of that, the compassion, the self-sacrifice, that kind of kenotic, right, self-emptying piece. Instead of this very hyper-individualist, it's about me, it was much more communal. So Cleve, why don't you respond first, and then Michael, I'd love to hear your thoughts too, but like what's kind of opening up for you during this time in terms of the church's response, problems of lack of access, injustice, you know, how should we be positioning ourselves right now?
Yeah, I mean, I think that's a good question. For one, I think it really causes us as a church to think about our theologies of care and what that means for different communities, different vulnerable communities especially, right? I'm trying to think of it more narrowly in relation to COVID. We have all these instances of, we see a lot of communities are having a hard time getting food, lack of access to care, folks who don't have insurance to get coverage for certain issues. And as we think about locking in stay orders, or what's the best method we should be using right now, you think about not only our community, but you think about those who come to Galveston Central, for instance, come for just basic necessities and services, and how do we get information to other people? So I don't know, I just think COVID really challenges the church, and challenges us, especially when a large part of our forming community involves coming together. And what I've just seen from a lot of vulnerable communities, at least, is they're more apt to experience some of the negative aspects of COVID. And a lot of folks can avoid a lot of contact in certain ways. And so you sent us an article, I think Michael forwarded us an article regarding mobility and how it reveals inequality issues. I'm interested in making links to that, to how that mobility might relate to us thinking about issues of care, also issues of what we might call a kind of providence. What was that? What did that have to do? What are the implications for that as we think about a theology of providence, and meaning who has God's care, and how is that revealed most in these kind of moments? What are your thoughts about that?
I think that's good. I want to come back. I want to flag this notion of providence and like prophecy or like when you have people who restrain resources that were intended for all people, keep access to the goods of life that by being made in the image of God and given that eternal divine dignity, when you have folks who are holding on to those goods and then you don't have these goods, it is your problem. I think the prophets have something to say about that. And so that's what I heard, Cleve, when you were talking. I might go back just a step back to science, back to social epidemiology for a minute. So we've seen, particularly with HIV, you know, kind of like the last major pandemic that caused a lot of confusion and a lot of stigma and a lot of shaming and a lot of blaming. In the years since HIV came onto the scene, there emerged this term syndemic. And what that means is epidemics that not only appear together, but exacerbate each other, make each other worse. So in HIV, you know, have sort of clusters of riskier behaviors. Sometimes people who are not able to negotiate safer behaviors that they might want, but they don't have the economic or social power to negotiate and make sure that what they experience is what they want to experience in the way that they want to experience it. So you have this cluster of health conditions and this cluster of social conditions, usually people who are more socially excluded, people who have a tougher time finding employment, people who are lower on the social pole and experience day to day this sense of not measuring up, this sense of not being enough, of not being valued as much, not being respected as much, having to work harder to maintain some sense of dignity in the social world that you're a part of. That plus economic conditions that of poverty and housing. So these things we've seen them before in HIV, and we see them come in again now with COVID, such that people who aren't able to negotiate where they work from, who have to go to a place where they're working from some place where they can't negotiate safer standards, where they're exposed to COVID, and if they don't want to be exposed to COVID, then they have to go home and not make money, to not pay the rent, to not have health care that can protect them if they were to become infected. Often in that article that I sent, demonstrated that people with lower income often have to work in places of higher social density, like more people in a place with less ventilation. And so their social exposures are often worse. And the people who end up in those positions are often people who were born into lower socioeconomic standards to begin with less educational opportunities. So then you have this bringing together of these economic conditions, these life conditions, educational conditions, and then if you want money, if you want food, if you want health insurance, you have to go and work. And oftentimes the place where you work and congregate have other people who are similar to you, who have higher risk profiles because they have higher density housing, or they have less ability to negotiate their own work safety standards. So mobility tends to be more restricted for people who have lower income. They have to go to certain places, and the places where they go tend to have more higher risk profiles of COVID. And this is empirical study demonstrating this. And then all of that contributes to a higher risk profile for people to get COVID infected anyways. And then the people who have less economic and social status, and the people who are higher risk of getting COVID, are the people who've had a lifetime of poor health, oftentimes. So like food deserts and nutrition is a major issue. The stress that I was talking about is a major issue. That a lifetime of stress, a lifetime of feeling like you don't measure up, what we would call socio-evaluative stress, would actually contribute to more dysfunctional immune system. And this is all well-documented science. So the people who are getting sick because of their current standards, or who are at a higher risk of getting sick because of current economic and social educational standards, are the same people who have a higher risk of lifetime of not accessing healthcare as much, not accessing nutrition, good nutrition as much, and a lifetime of feeling like they don't measure up. So their stress levels are higher, their immune system is more dysregulated. So all of that within certain populations leads to these disparate outcomes that make risk of COVID infection worse, and not only that, but after they're infected, risk of severe disease and death worse too. And so this notion of syndemic that we observe in HIV, we're beginning to observe, and I think in the years to come, as COVID is more researched by social epidemiologists, is going to be something that emerges. And still the question for the church is, what is your prophetic voice in all this? How do you say, now God intends all people to have their dignity respected. God didn't build this universe just for some goods to be stored up in little pockets here and there, but by the virtue of someone being made in the image of God, they deserve an adequate access to health, not just health care, but the whole range of things that affect people's health. What is the prophetic voice of the church in the midst of the COVID syndemic?
Dude, that's so good. Yeah. And I think that's where, Julia, our other co-pastor, preached this last Sunday, and, just naming these realities. And again, this kind of unveiling that's happening, and too often the complicity of the church, right? In silence and focusing on kind of like esoteric spiritual things without like incarnational lived reality, right? Cleveland, my mutual friend, Matt Russell, has this saying. He's like, people won't care if you can save their soul if you can't save their ass in the meantime, kind of thing. And I think that's where we're seeing all of this. Right, your nonprofit is called Sozo, right? Which is this beautiful word where whatever salvation means, it's got to be holistic. It's got to include all of us, and that means health, like you described it. Yeah,
that's right. I mean, that is kind of the notion of Sozo, that over the years and generations and epochs, we've kind of refined more narrowly what salvation means, so that for some people it doesn't really mean anything until you get after death, and that's where the reality is settled. But that's very different than Jesus's vision of let it be on earth as it is in heaven, of kingdom of God, and his Luke 4 inauguration speech, where he said good news for the poor and freedom for the captives. That's a very different vision of salvation and God's work in the church than what we get from the New Testament. And if you don't actually see the New Testament in light of the meaning of its authors, and the meaning of it, and it's kind of sits in Laban, like its setting in life. Yeah. If you only see it through this narrow vision that is not too much different than a vision that could endorse slavery, honestly. If you don't see it where it is, then it can't be salt. It's not light. It doesn't help you see reality in a different way. But if what you see in the cross is not just an image of, like a plus sign, but is the acute expression of the Roman Empire and its power to coerce people to certain types of behaviors and to indicate who matters and who doesn't matter and what systems are in and what systems are not in. If you don't see in the cross a competition between the claim that Caesar is Lord and Jesus, the suffering Christ, is Lord.
Yes.
If you don't see that, then the revolution transformation that sozo means is.
Yes. Yes.
That's powerful.
Oh.
Wow.
Well, I was just reflecting with some classmates this week, and we had a seminary professor who talked about that Jesus is Lord phrase, right? And for many traditions, right, it's lordship that qualifies Jesus, and so it's this very hierarchical, top-down kind of problematic power structure. But I had a professor that really pushed this, said, no, it's Jesus that qualifies lordship, right? And it's this downward movement. It's solidarity with the poor. It's all the stuff that we're talking about, this prophetic voice of the church. And it's this downward movement, which is hard right now during COVID when so many of us are tired, right? And we're ready for the pandemic to be over. We're ready to go back to the comfort of being in our sacred spaces, of seeing the people that we love. And I think this is a beautiful reminder, again, of that kenotic call, right? To move downward, to find ourselves in solidarity with these folks that Jesus found himself in solidarity, and maybe find whatever this word salvation, sozo, means in that space, right?
Yeah.
So, as we're kind of like closing out here, maybe just some some practical things. Like, what does it mean for us right now? What can we be doing? Or any just closing thoughts? I don't want to keep us too narrow. This has been beautiful.
My church, South Main Baptist Church, the pastor asked me back in April, I guess, when I thought that we could be meeting again. And I told him, I don't think the first question is when. I think the first question is how. And I don't think there's a lot of binaries for me that have been broken during this season. So like the first binary, on the health side was, either you live from COVID or you don't, and that's the ultimate thing. But now we see that people who live with COVID, half of them suffer from neurocognitive deficiencies or foggy brain or some challenges they report for months after. And maybe 10% we see are long haul COVID sufferers and have lung or kidney issues or cognitive issues. And that gets back to like healthcare access. So if a higher proportion of people without insurance are more likely to get COVID, what does that mean long term? Like, where are they going to be getting their long term care for COVID? It's not just they live, so that's okay. No, like maybe they live, but they have long term issues that need long term care as a part of a long term system that reflects God's demand for dignity and respect for each person. So, like, how are we going to make the system so that they can have that? I think that's part of the question. But anyway, back to when the church opens up, kind of operationally, when versus how. I don't know enough about what Central does, kind of week to week to think about it. But I think that if there's a way, y'all got the beach, like, we're in Houston, boring old flat concreted Houston, but y'all have the beach. So there's good airflow there. There's good ventilation. There's ways to manage droplet borne stuff. So if part of what you guys can think about is we're not comfortable being in our building now because ventilation is such that it's a problem and we want more people there, but maybe you can go to the beach and have like a beach thing. Cause I do think, part of the fatigue is part of, like, we weren't meant to live in isolation from each other. And that is a hard thing that has been asked of us for a long time. And if there's a way that we can rebuild some things safely, then I think that's part of it too. We don't need to be dogmatic about, I'm not doing this because it's dangerous. Like, you have to think, like, what is the real risk incurred in this activity? And you guys going to the beach and having something there, or having something else outside that allows for distancing, so it's not like, so you can maintain 6 feet between clusters of people who would see each other anyways. And then in a well-ventilated environment, And then make sure that whoever is like singing, or Michael, I think you yell a lot at your sermons. Is that right? You yell
lots of fire and brimstone coming from me. So it gets hot in there. Yeah.
Yeah, but like whoever is vocalizing, just to respect that there's some risk of aerosolized virus coming from them too. So make sure that the air flows well. I don't see it as all or nothing. I'm not trying to tell your church what to do. I just think the question is not necessarily when, but how, and then thinking through that amongst your leaders.
That's so helpful. Yeah, we did an outdoor communion service a couple weeks ago, and it was the first time kind of being together. It's the first time we'd celebrated the Eucharist, and it was like 8 months at the time, right? Which is something we're used to doing weekly together. And it was that powerful connection point that you're talking about, of people being safely distanced, being able to see each other, and also finding safe ways through those prepackaged, they're terrible, but it's Jesus, right? So
yeah, that's right.
Yeah. So I think that's a good word to find creative ways to meet the whole plethora of needs that we're seeing right now.
Yeah, and on that, I remember the first time seeing the faces, even masked, of some of the people in our congregation that I hadn't seen in a long time, and this like sheer exuberance at being in that moment with them, and then how quickly that can be replaced by a sense of boredom or curiosity or like lack of thankfulness for like just being alive with them. How easy it is to fall back in a pattern of taking for granted the things that contribute to our well-being. So I would, this is as much a word for me as anybody else, but take stock of the things that really feed your spirit and the things that you're deprived of now. And remember, like that first, it's like getting a breath out after holding your breath for a long time, like maybe you can't breathe or something, and then you get a breath and that restores life to you. And then you get back into breathing and you take it for granted again that oxygen is passing through your lungs again. But if you can stay mindful of that, I think there's a lot of wisdom that this season has to teach us. So if we're attentive and listen to it, and maybe that'll teach us some about perseverance and the things that make our life valuable and worthwhile. And hopefully those things help us get through this last little bout of non-normal, not even new normal, but kind of non-normal until the vaccine makes its rounds and the risk goes down and we don't have to worry so much anymore.
Yeah. Cleve, you get last word. You want anything?
No, I just think it's a lot to chew on. I think there's a lot being raised also. I think we need to get Michael to come back to think more broadly about the relationship between science and our faith as well.
Yeah, I'd love to do a whole thing on that. That'd be awesome.
I think these moments really bring to the fore those kind of conversations that we often don't have, right? About the relationship between faith and science, and why there has been so many disconnects and what that might mean, how that challenges our notions of liberty versus care and all these things. So this has been really helpful and really informative. I think what I really gathered as well is your term of what we've been kind of phrasing like there's multiple pandemics, but I love your terminology when you're studying medical disease about syndemics. I love how you brought that together. And I think this is that's just one of many ways that I think science can help us translate, right? I think, Michael's been very informative today in helping us to bring links where we think there are often these separations, because it provides a whole new perspective on how to think about as he's been saying, the common basic dignity of human life and what that means for us as we begin to structure how to act into that. And so thanks for your time. I think that's really appreciated today.
Yeah, I enjoyed it too, Cleve. Thanks for letting me be on with you and Michael. Been good.
Yeah, we'll do this again soon. This is great. So yeah, are you over at UTMB right now?
Yeah, this is my office.
I think I can see you out my window or something. So yeah, live right across the street. So anyway, thanks so much for your time, Cleve. Thanks for being on this too. And Central, if you have other questions or things, feel free to leave those in the comments, and we can find a creative way to kind of get at some of those. So guys, y'all have a great rest of the evening. Thanks again.